When someone doesn't have adequate access to oral health care, they can be impacted in many ways. Their overall health suffers, their appearance suffers, which can impact their ability to function in their communities, to get jobs. And so this conversation's really become about how to drive more equitable access to care and to really engage people in every corner of the state and every community in a way that works for them.
Pennsylvania has ranked in the lowest percentiles in the nation for children receiving preventive dental treatment. As the sixth most populous state, Pennsylvania's 13 million residents come from large metropolitan cities as well as vast rural areas that are bigger than New Jersey, Massachusetts, New Hampshire, and Vermont combined. As a strategy to improve oral health care and make a change in our state to ensure that every Pennsylvanian receives quality health care regardless of where they live, the Pennsylvania Coalition for Oral Health spearheaded the first ever Pennsylvania Oral Health Workforce Innovation Summit in November 2016. More than 120 diverse stakeholders joined in the discussion to assess our current needs and work towards change for the future.
The ability for different stakeholders to come together and really congealing around a common theme. From my perspective, the theme is around change. So I think a lot of us are excited about discussing the ideas and taking that and translating that into an action plan.
Oral health has become a primary focus in many different ways. So I think that what's exciting to me is we're seeing changes, and we're seeing a change in focus to including oral health in overall systemic health. I feel that we have gathered a group with a common goal of increasing our access to dental care. And so what I think we have really seen with the summit is an alignment of our ideals. We're seeing that there's new ideas out there. We're seeing where the problems lie. And I think what's going to come out of that is some amazing new ideas, utilizing what we have been doing and what we could be doing.
The diversity of the number of attendees and the participants is really terrific, from dental school deans to hygienists to dentists and foundation people, insurance companies. It's just going to be a wonderful group of people all trying to work on the same subject. I think the possibilities are limitless.
Those stakeholders really bring so much to the table, and we are changing because of that. We're all in this together, and we really work hard to make sure that we're understanding each other and we're moving together. This has been such an exciting experience for the coalition because we're really making change because we're working together.
This ambitious two-day statewide conversation focused on strategizing ways to build a sufficient and effective workforce and led to spirited conversations around 4 key themes central to improving the Pennsylvania oral health workforce.
In Pennsylvania, there are a number of people who are underserved just because of where they live. It has nothing to do with their economics or anything else. In the rural areas, there are very few dentists, and many of them have gray hair like me, and we face an even bigger shortage of dentists in those areas.
Some of our strengths that we have in the state right now would include a really dynamic workforce. We have the inclusion of the public health dental hygiene practitioners now. We've got community health workers. We've got insurance companies on board. We have dentists becoming more public health minded. So we're approaching the problems with a team effort, and we're using all of our staff and all of our positions to their fullest ability.
I feel that the summit has placed an importance on how we can access our current workforce and possibly make some changes to the type of care that each caregiver can give as far as a public health dental hygiene practitioner, an expanded function dental assistant, and of course also the dentist. This summit has exploded many different options for us to move dental care and oral health care, not only in the dental community but also in the medical community.
I've met people that have different jobs and different purposes and come from different places in the dental workforce model, and made some new friends that I think perhaps could be a pathway to getting problems resolved.
In the spirit of openness and inquiry, participants shared their perspectives and generated practical models or prototypes by building on each other's ideas.
We are striving towards actionable prototypes efforts that we'll be able to live on after the summit and really serve to guide transformational change as we think about workforce issues and then how our workforce impacts access.
Well, the summit is only the beginning, but we need people to be involved in that.
If we can make a little step forward, that would be a great leap.
We have people from different communities, so it's great to have all these passionate people together. That will be the great moving force for us.
The summit has the potential to kickstart efforts that will impact every corner of the state and allow people to better engage, improve their health, and do that in a cost-effective way that opens many more doors for them.
I've been waiting for something like this to come around, some kind of tangible solution. This event is going to reshape where we go in 2017 and beyond.